Do we use a mesh to repair all hernias? This is a very common question that patients ask. That is mesh required to repair all hernias? The answer to this is no. There are two situations, or commonly two situations, where we do not use a mesh to repair the hernia. Number one is congenital hernias. That means hernias in children or in newborn. If you remember what hernia is, it is a defect or a gap in the muscle associated with the weakness of the muscle through which the intestine or something comes out. But in case of children, there is just a gap, muscle is not weak. So, by principle, we do not place a mesh in case of congenital hernias or hernias in children. The second situation is very important to know. These are hernias which are complicated. For example, in case where it is strangulated or obstructed and the intestine has gone bad, or whatever has gone into the hernia has become diseased or it has become infected. In such cases, we may have to remove the intestine or we have to remove the diseased tissue, and in these situations we do not put a mesh. This is because the mesh, if it becomes infected, it will cause problems. So, in case of complicated hernias, very commonly, we do not put a mesh. This is also the reason why it is very important to undergo a planned elective operation when you have a hernia. If by chance the hernia becomes complicated, then no mesh is placed, the defect is repaired, and in most of the situations, a planned mesh repair has to be done at a later date. So it is very important for this matter that you plan an elective operation whenever you find that you have a hernia.